our kids, I think they're one of the most important things we could do in the midst of this unfortunate pandemic with which we're dealing. Unfortunately, the virus is very infectious, and the vaccine does a good job of decreasing the likelihood that a child will get the disease. And if they do get the disease, despite getting the vaccine, it makes it more likely that they'll ride it out and not be particularly sick with the disease. So I think it's very important. It's one of the things we can do that can make a big difference. A lot of kids get a little bit of a sore arm or get a little bit of a flu-like feeling over the first day or two, actually more after the second dose than after the first dose. But those things are transient, they just go away. And they're actually, in some sense, a good sign that the vaccine is taking and that the body's immune system is responding to it. That's what people experience, both kids and adults, when they have those minor issues after vaccines, whether it's to the COVID-19 vaccine or other vaccine. It means that their body is responding to it and preparing the person to be ready to attack the virus if it comes into their system later on in a positive and meaningful way, so they don't get sick or they don't get very sick. As far as the average child without other medical problems, there have not been any deaths and virtually no significant long-term problems. And you counterbalance that versus the disease, and there have been a lot of deaths in children. I think in the last week or so, the total was now over 800 children have died from COVID. So it's a clear risk to go unvaccinated, and the advantage and the risk for the vaccine seems to be virtually zero. So I think, on balance, as you mentioned, that how we kind of weigh those things against each other, the scales tip dramatically toward it being more beneficial to have the vaccine. As with anything new, there are a wide range of opinions about the vaccine. And then there's a bunch of folks that are questioning because they don't have the medical background or they don't have all the information. And those people are usually very gracious about hearing what I have to say. And I try to outline kind of the risks and benefits, just like we talked about earlier, and explain to them that I think that getting the vaccine is in their child's best interest. There's been a big uptick in hospitalizations now with children, unfortunately. Those children are much more likely to have not been vaccinated. Some children who get vaccinated do get sicker and have to be in the hospital, but that's uncommon. So that having your child get vaccinated makes it less likely they'll be in the hospital. Most of the pediatric deaths have been in unvaccinated children. So if you get your child vaccinated, you're less likely to have your child, heaven forbid, die from this terrible virus. But I try to give them the best information I have and help them to make the best decision they can make, in this case for their child. And most people are really open to that. The 12 to 17 age range, was recently, in the last month or so, approved for a booster 5 months after the second vaccine, which was a Pfizer. So that's still the recommendation, as far as I'm aware, for the 12 to 17. I say as far as I'm aware, because sometimes these change almost daily, but that's been in place for about a month, and I don't think that's changed. And then the 5 to 11, there, as far as I'm aware, there's no recommendation for a booster yet, because that was only approved back in October, and we're not yet to that 5 to 6 month stage where it might be recommended that that be boosted. As with many new things, the recommendations tend to wait until almost the last minute to make sure that they have as much information before that decision's made. So I don't anticipate there being a recommendation for the 5 to 11 range until it's been about almost exactly 5 months since the second dose would have been given to a 5 to 11-year-old. So I bet you that's not going to come out for another 2 or 3 months. They've been looking at the little kids, the under 5-year-olds, because those kids get it also. Some of them have the multi-system inflammatory disease, which has been just terrible for a few kids, not very many, but for a few. And they haven't moved forward with vaccines for that group because they were able to show there was not very much response to only a couple. So they're actually doing a group, I understand now, where they're doing a third dose, as we do with other pediatric vaccines. For example, the DTP or DTAP that we use for little kids gets 5 doses to maintain immunity and establish immunity, with 3 given bam, bam, bam at 2, 4, and 6 months of age. We do the same thing with Hib vaccine, and we do the same thing with pneumococcal vaccine, because 1 dose doesn't do it. Vaccines have been one of the most, if not the most, life-saving interventions that we've been able to bring forth in medicine. Far more than cancer therapy, far more than heart treatments, surgeries, and medical care, far more than trauma care. Vaccines are, I would put forth, the miracle of the 20th century and now the 21st century. Far and away, the advantage goes to getting the vaccine. In the last couple of weeks, there's been like 2 million kids that have gotten COVID. And there's been a whole bunch of kids put in the hospital, but the vast majority of the ones put in the hospital didn't have the vaccine. The ones that do go in the hospital who did have the vaccine tend to be less ill. So again, the scales tilt to the advantage being getting the vaccine. And everybody's immune system's a little bit different. To give the vaccine is the right thing. And I think that tips the odds in everyone's favor by doing that. But I want kids to have close contact. I don't want kids not wanting to hug their grandma or grandpa. I don't want kids afraid to be near people. I want them having contact. So I think when there is close contact, trying to be as careful as we can with the mask use is probably the right thing to do. And getting the vaccine, I keep coming back to it, makes it dramatically less likely that you'll acquire the disease or become terribly sick when you do, if you do acquire the disease.